let's take a look at the AnyLogic model. So I think, my first reaction when I see this thing is, wow, it just seems real busy. And I want to see if we can unpack this so that, by working through this thing carefully, I think we're going to find that it actually is intelligible. So I think the first, maybe most notable block here is this thing in red. And you can see there seems to be, a lot of parameters. And that's exactly what this section of the model is. It's going to be, there are going to be some key parameters that we're going to use, and we're going to, like little knobs that we're going to be able to twiddle to adjust operation of this workflow. So, for example, we could, for example, schedule these folks to come in instead of every 90 minutes. I'm going to go and click on this just so you can see what it currently looks like. That's the inter-arrival time, the average inter-arrival time. It is 90 minutes. That's the sort of the current base setting. But there's some real questions about, how frequently we should have these folks arrive, because we've got two objectives in this case. One is to improve the patient experience, and having them wait less could be meaningful. So instead of a 3-hour wait, if we could cut that down to an hour and a half or less, that would improve their experience waiting to get into surgery, less time for in-hospital anxiety, and certainly the folks that are their friend or family attending the surgery or helping them could benefit from shorter wait times. So there's that KPI, and then there's the KPI that deals with the number of surgeries we're able to complete in the day. So the bottom line here is we're going to control our simulations from these parameters. Now you can actually go and change them right here by clicking on each of these. Here's the inter-arrival time for the other OR suite. So we've got two inter-arrival times. One is for this is our top OR suites. There's 2 ORs there. And then there's a second set of 2 ORs. That's the second suite, so to speak. And we're going to treat these as completely independently. We've got a surgeon associated with each and an anesthesiologist associated with each in the base case. You could also go to, I believe it's run configuration, just see if that's true. No, it's simulation. So I'm in the wrong one here. Simulation main. And you can adjust all these parameters nicely off simulation main without having to sort of like dive into, each of these little parameter blocks. So that's pretty cool. All right. So what I want to do now is look at one of these OR workflows. There's 2 of them, and they work completely independently. So once we've understood one, we can understand the other. They're both in here because we're choosing in the base case not to connect them other than to have a shared registrar pool and EVS pool. So the anesthesiologist is dedicated to this track, the surgeon is dedicated, and of course the ORs are dedicated, right? But it's served by a pool of registrars and a pool of EVS folks, the folks who clean up and prep for the next surgery. So let's go through this. We're going to have patients come in every 90 minutes in the base case with a standard deviation of 5 minutes. I'm not giving us any control over the 5 minutes. You could put in an extra parameter if that's something you really want to get after. But we're assuming that there's a little bit of variability, and it's pretty low with respect to patient arrival variability. All right, then we're going to start a timer right here. And that timer is going to figure out from the time of arrival to the time of completing surgery, what is the time? And we're going to call that the time in system. And we're not going to be interested in the recovery process or the discharge process, but rather just how long does it take from time of arrival to completion of surgery? Because I think at least friends and family who are waiting to hear the news, that's the time they're on the hook. At that point, they're going to get their news unless there's some special reporting workflow, which we're not considering here. All right, so that's our timer. we get the patient register that has a mean that's specified here. Currently, that's at, in the base case, at, let's see, where do we have that number right here? The mean is, I believe, try that again. Five minutes with a standard deviation of 2 minutes. That's rapid. All right, then we're going to seize the resource, the OR. So we have these different resource pools located in the middle here. And there are two resource pools for operating rooms. So operating room pool A has num ORs pool A, and that there's two currently in the base case. And the same is true for operating room pool B. So those are the ORs. You've got the EVS folks. How many are there? Well, num EVS pool. And that's currently two EVS people. How many registrars? We'll get those here. Do I have number registrars? There they are. In pool A, in pool B, it's so here's the number of registrars. There's two. Okay, so these are pooled, and both tracks use the registrar pool and the EVS pool, but otherwise they have a dedicated anesthesiologist. There's only one. I just see that. So number of anesthesiology pros, one. So that includes anybody who's able to serve in any function related to anesthesiology. And we'll talk more about that. Okay, so then we've seized the OR. We're going to grab our anesthesiology pro. We'd at least need the anesthesiologist. If there are other professionals who can assist there, that's something we could consider adding as part of our process innovation. Then we sedate, and the sedation has a mean of this sedate time mean. That's the 25 minutes. That is in the base case with the standard deviation specified here by sedate time standard dev. I'll just show you that. So, referencing the times here in the sedation process, reference these parameters. I want to show you where that's actually implemented. It's right here. We're using a truncated normal distribution with sedate time mean, whatever you specified to be, and sedate time STDev. Okay. So from there, we go to surgery. This has got a mean of, in this top track of surgery time mean A, surgery time standard deviation. A is the standard deviation. If you're in this lower track, it would be surgery time mean B and surgery time standard dev B. All right, so now we're done with the surgery. The patient is actually headed off to recovery, and we release the anesthesiology pro. The surgeon is released immediately. The surgeon is only involved here. The anesthesiologist has to be involved in the sedation and surgery. We stop our timer because patient is now out of the surgery. We clean the OR, so that is going to involve grabbing somebody from the EVS pool, and then at the end of all of this, we release all of our resources, and our patient is essentially exited from the simulation. Track B, exactly the same. The parameterizations allow us to create a different look. So, for example, one idea that you may entertain is perhaps assigning lower BMI patients to the track A ORs and surgeon and anesthesiologist, and maybe heavier BMI folks down here. Whether that makes any difference in the performance of this of these workflows is an open question, but that's something that the adjustments here in the parameters allow you to entertain. Now, I think the last piece, just to get our introduction to the model, is to look at our statistics. So we've got several. You can see these ones here all look at the utilization of the anesthesiology pro A pool. So this pool here, this pool down here for utilization of anesthesiology pros B. We're also looking at the surgeon utilizations, and then the ORs. And also the the registrar and the cleaning pool. I want to just see if I can adjust this one. Mess that up. Here it is. Just a tad too far. Actually, I guess that is fine. And there's the registrars. I'm also getting a histogram of the flow time, that is the time of arrival to completion of surgery for each of these two surgical suites. And then there are some time plots here that give us sort of a rolling look at the utilization. It only gives us this for about 100 minutes, the utilization of the anesthesiologist in the A track, the surgeon in the A track, and then the ORs in the A track. This is an interesting way of sort of getting a sense if your model is functioning correctly, and just to see, how these folks' workday sort of unfolds. All right, so bottom line, we've got two tracks here that are currently connected in the base case only through pooled access to a pooled EVS pool and resource, and pooled registrar resource pool. Other than that, they each have a surgeon, they each got two ORs, they've each got an anesthesiologist, and otherwise, other than the EVS and registrar pools, they function independently. We control the parameterizations of both of these tracks using these parameters here. And the nice thing is, if I go to simulation main, I can see all those parameters in a snapshot right here and adjust them. And you can see I do have two ORs in each. I've got two in the EVS pool. I've got how many registrars? Two. And they're all the details for the base case. And then I've got some statistics that I'm going to collect. I've also got my objectives. Remember, minimizing the waiting time as much as possible to the extent that it hopefully doesn't impact our ability to complete 6 surgeries. And then, we do want to get that volume up from wherever we are to 6 surgeries, if that's at all feasible. Then it may not be. Okay, that's the base case. That's the model.